Hi, I'm Dr. Tim Gale, and this is a presentation on COVID-19, tourism and hospitality. In this session, I'll discuss the origins of the COVID-19 pandemic and its significance in terms of cases, mortality and geographical spread. I'll also argue for the importance of social distancing and avoiding all but essential travel. Finally, I'll evaluate the actual and anticipated impact of the pandemic and subsequent restrictions on human mobility on the tourism and hospitality industries, and share some predictions for the short and medium-term future for tourism and hospitality in light of COVID-19. On the 11th of March 2020, the World Health Organization declared COVID-19 a pandemic. It was described by Secretary General of the OECD, Angel Guerra, as the third great shock of the 21st century and the biggest, after the September 11th terrorist attacks and the global financial crisis. It's a public health crisis, but also an economic, financial and social crisis. It's led to a stock market crash, unemployment, negative oil prices and so on. It's thought to have originated in animals and moved to humans in the context of a seafood and live animal market in Wuhan, China, and has spread to 188 countries to date, with over 36 million cases and 1 million deaths as of the 8th of October. You can see from this infographic from Visual Capitalist how COVID-19 ranks alongside other pandemics throughout history. In modern times, the Spanish flu and HIV/AIDS contributed to 40 to 50 million deaths and 25 to 35 million deaths respectively, compared to 1 million plus at present for COVID-19. So what is COVID-19? It's a disease that affects the respiratory system in humans. The elderly and those with pre-existing medical conditions or comorbidities are the most vulnerable. But anyone can develop symptoms, and those symptoms are similar to the common cold or pneumonia. It's caused by a virus, SARS-CoV-2, which is transmitted person to person by airborne droplets which are projected through coughing and sneezing. It can also be passed on through contact with surfaces. The virus tends to last longer on hard, shiny surfaces than soft, porous surfaces. People infected with the virus can be contagious prior to and maybe without presenting with symptoms, and this is a really important point that we'll come back to later. Above all, it makes human mobility dangerous, and this is what's prompted restrictions on international and intranational travel by many countries to contain the spread of the virus. This graphic from Dr. Ian McKay, a virologist, shows that the infectious period for this particular virus lags into the asymptomatic period, which means that we can be contagious without even knowing we have the virus. Here's a timeline for the first 2 months of COVID-19. On December the 8th, the first patient developed symptoms. December the 31st, China had alerted the World Health Organization about several pneumonia cases that were troubling. On the 1st of January, Wuhan's wholesale seafood market was shut down, pinpointed as the origin of the virus, and the virus was given the name SARS-CoV-2 on January the 7th. The first death in China was recorded 4 days later on January the 11th, and 2 days after that, the first case outside China was reported in Thailand. By the 23rd of January, Wuhan had been placed under quarantine with rail and air services suspended. The death toll climbed to 132 by January the 29th, with 6,000 new cases reported, and a day later the World Health Organization declared a global health emergency. Note, not a pandemic at this stage. On January the 31st, the US responded by restricting travel from China. Into February. On February the 5th, the cruise ship, the Diamond Princess, was quarantined, having recorded a number of positive cases in passengers. On February the 11th, the World Health Organization named the new disease COVID-19. On February the 21st, the Lombardy region of Italy, which had become a hotspot for COVID-19, was locked down. Then on March the 9th and March the 14th, either side of the World Health Organization declaring COVID-19 a pandemic, Italy and Spain were locked down respectively. On March the 16th, the number of cases reported outside China had overtaken those in China, and on March the 28th, China took the decision to temporarily suspend the entry of foreign nationals into the country. By April the 7th, the situation in China and in Wuhan had improved enough to end the lockdown. Nevertheless, on April the 20th, travel restrictions had been imposed in 100% of countries. Due to variations in counting methodology, and quite frankly political spinning of the figures on cases and deaths, the most reliable way of measuring the number of deaths from COVID-19 is to look at excess deaths. This allows us to make reasonable country-by-country comparisons. You can see from these graphs produced by John Byrne Murdoch at the Financial Times the number of excess deaths from COVID-19 in selected countries. Of the countries depicted here, the United States, the UK, Italy and Spain are among the worst for excess deaths, but don't forget other countries like Brazil and Iran, which are not represented here. The response of governments and public health authorities to the threat posed by COVID-19 has been to deploy a range of measures associated with the term social distancing. This includes advocating self-imposed behaviours reinforced by peer pressure, such as standing 2 meters apart from the nearest person, to more radical steps including forcing schools, universities and workplaces to close and people to isolate at home. There's also the promotion of hand washing and respiratory hygiene, for example using tissues when you sneeze or cough, and the imposition of travel bans. The objective was and remains to slow the spread of the virus and avoid a rapid exponential increase in cases that outstrips the capacity of national health systems to cope, buying us time until a vaccine can be developed, which early in 2020 was estimated to be 12 to 18 months away. That is, if it can be developed at all. This map by Frontex illustrates the various restrictions imposed by European countries to combat the COVID-19 pandemic. At the height of the crisis, a number of countries such as Spain, France and Italy had declared a state of emergency, and all countries in Europe had imposed some restrictions on entry by air, land and sea, and on schools and public gatherings. Initially, the UK government chose not to follow the lead of other European countries in imposing a lockdown and did not prohibit major events such as the Cheltenham Festival of Horse Racing, with an average of 63,000 racegoers a day, and the Premier League and UEFA Champions League football from going ahead, or indeed prohibiting people from meeting in general. The onus was placed on individual businesses to mitigate risk. For example, food service establishments stepped up cleaning regimes, stopped handling cash, and moved to contactless payments, and removed furniture to minimize dwell times. Ultimately, however, the government was forced to announce the closure of pubs, clubs, theatres, cinemas, gyms, leisure centres, etc. on the 20th of March, when they instructed people to stay at home unless shopping for necessities, exercising outdoors with a mandatory limit of 1 trip outside per day, or commuting to work where essential or where home working was not possible. However, some people still chose to visit beaches, rural areas and holiday homes on the weekend of the 21st and 22nd of March, as satirised in this discomforting cartoon from the Times. The effect of the pandemic on mobility in the UK was profound, even before the lockdown. Data on hospitality footfall trends indicates drops between 16 and 35% in UK cities on the 30th of March. A well-known 5-star hotel in central London reported occupancy of around 17% at that time, compared to the London average for February of 76%. In April, the number of passenger vehicles transported on Channel Tunnel shuttle services was down 91% on the previous year, at 19,682. Data from the England Occupancy Survey for May 2020 revealed just how calamitous the decline has been in terms of revenue per available room, a key metric for the accommodation sector, compared with the year before. Falls in RevPAR range from -73 to -85% across the various regions. Setting the numbers to one side, we have been beset by images circulating in the newspapers, on TV and on social media of empty destinations, airports, railway stations, cafes and so on, giving us an idea of what a world without tourism and hospitality would look like. These scenes of empty theatres and boarded up properties in central London look as though they've come straight out of the post-apocalyptic horror movie 28 Days Later. The photographs were in fact taken in August 2020. The impact on our industries is profound. They are exposed to the worst of COVID-19 and the various containment measures I've described, and the ensuing economic crisis. Global flight numbers have dropped, restaurant bookings have collapsed, and footfall, as we have seen, has fallen significantly in retail and recreational areas. The pandemic and the lockdown disrupts the demand for tourism and hospitality products, services and experiences, and also the supply arrangements that are necessary to meet that demand, meaning that businesses and organizations, large and small, private and public, have suffered tremendously and face closure or radical restructuring and downsizing. The truth is that many will fail before the crisis has run its course, including some well-known high street names. Even some months after the outbreak, planes remain grounded, large attractions closed, and many major events postponed. This has monopolized the headlines, but don't forget that the industry comprises many small and medium-sized enterprises, public sector organizations, and charities, and those are affected too. There have been some high-profile closures and cancellations as a result of the pandemic, not least the Tokyo 2020 Olympic and Paralympic Games. This has been postponed to 2021, but might end up being delivered in a scaled-down format or perhaps not at all. Also, California's Disneyland, Orlando's Disney World, Disneyland Paris, Disney Cruise Lines, and Universal Studios all closed temporarily. The Glastonbury Festival was cancelled, on its 50th anniversary no less. In Japan, we've seen the cancellation of major cherry blossom festivals, which attracted an estimated 63 million people in 2019 to view the bloom, spending around 301 billion yen or $2.7 billion US. Add to that list Wimbledon, San Diego Comic-Con, Edinburgh's August festivals, and countless smaller events and attractions, and you get an idea how disruptive this has been. Naturally, there's a huge economic impact, but this also represents a loss of opportunity for social connection and engagements through shared experiences. Some events have moved online, such as the Twitter Model Train Show set up after the cancellation of the London Festival of Railway Modelling, and involving exhibitors sharing video and photographs of their layouts through the social media platform. There have also been live virtual events such as the 2020 Grand National, where a computer studied the form of the horses that would have entered the real race and played a virtual simulation that punters could bet on. Lots of visitor attractions offer virtual tours now, such as Weston-super-Mare's Grand Pier and the Natural History Museum in London. And there are numerous opportunities to visit places with no public access, or past events and exhibitions. The virtual serves as a stopgap, but it is difficult to monetize and is not a replacement for attendance or co-presence at attractions and live events. Here's a couple of screen grabs from those virtual tours I mentioned. They're based on the Google Street View platform and created using an omnidirectional camera. You can interact with the exhibits and walk around, and they're a great way for those attractions to stay connected to the public while closed to visitors. The list of business failures and businesses and organisations in trouble keeps on growing. SLG, the group that owns Shearings, Wallace Arnold and some other well-known travel brands, has collapsed, as has the restaurant chain Carluccio's. The National Trust has announced membership cancellations of 4 times their usual rate, and they're not pursuing new projects or acquisitions for the time being. No less than 30,000 pubs and restaurants may remain closed after lockdown. Those that survive might struggle to make a profit due to social distancing measures. In coastal communities, 3/4 of businesses are closed, 7% permanently. Also affected are aviation-reliant cities and large towns like Crawley. British Airways has suspended short-haul flights to and from Gatwick and plans to make 12,000 staff redundant, while EasyJet is shrinking its fleet. The malaise extends to charter flights and package holidays, with TUI closing 166 of its high street stores in the UK and Ireland. The government has responded by offering unprecedented financial support and a raft of schemes, including the Coronavirus Large Business Interruption Loan Scheme, targeting businesses with a turnover in excess of £45 million, and the Coronavirus Job Retention Scheme, or furlough, where the government pays up to 80% of the employee's salary. Businesses have also been given a rates holiday for the financial year 2021, and there's also grants for retail, hospitality and leisure businesses and other small businesses. £83.5 million have been paid out in grants to 6,500 businesses up to the 27th of May. VAT, that's value-added tax, was cut from 20 to 5% for tourism and hospitality businesses, and that lower rate has now been extended to March 2021. Planning regulations have been relaxed to allow pubs and restaurants to operate a takeaway service, and there was also the Eat Out to Help Out scheme in August 2020, when purchases of food and non-alcoholic drinks in restaurants, bars and coffee shops were subsidised by the government to the tune of 50%. Suffice to say, some interventions are less helpful. For example, the imposition of a 14-day quarantine for arrivals into the UK. This is hugely damaging, especially for the aviation industry, but also the wider economy. And the fear is that the UK will develop a reputation as being closed for business with the rest of the world. It was tempered with the announcement of quarantine-free air bridges, with countries from where British residents could travel to England without self-isolating. However, the list of countries changes so often and with very little notice, making it difficult to book travel with confidence. There has also been confused messaging. Early in the pandemic, we had to stay at home, but that's now switched, in England at least, to stay alert, and it may change again by the time you view this presentation. Some people have interpreted the softening of the message as an easing of restrictions, leading to crowded beaches and parks, and scenes like we saw on the Dorset coast at Durdledore and Bournemouth Beach in May and June. Such disregard for one's health and the health of others has led to the coining of a new term frequently used on social media to disparage these people: COVIDiots. The fear is that crowding in public areas will lead to a second wave of infections, and this fear is also shared in the United States, where the Grim Reaper, no less, has been spotted on Florida's beaches, protesting against the lifting of lockdown measures. The pandemic presents a challenge to international tourism like no other event in living memory. After 7 consecutive decades of growth, barring the odd blip, we're about to see a significant reduction in international tourist arrivals. In an early forecast, the UNWTO estimated that 2020 arrivals will fall to between 320 and 610 million, depending on when lockdown restrictions are lifted, whether in July, September, or December. That equates to 850 million to 1.1 billion fewer international tourist arrivals, a reduction of 58 to 78%, and a loss of between 910 billion and 1.2 trillion US dollars in export revenues. This puts at risk around 100 to 120 million direct jobs in tourism. There are grounds for cautious optimism, as demonstrated by this SWOT analysis produced by the UN World Tourism Organization. Let's start with the strengths. Tourism is a resilient industry and has faced crises in the past, showing the capacity to bounce back rapidly. A rise in domestic tourism in many countries acts as a buffer while international tourism recovers. Tourism and hospitality are adaptive, as demonstrated by the rapid implementation of new safety and hygiene protocols and the promotion of travel closer to home. Leisure travel should recover quickly once the threat subsides, and in the meantime there has been unprecedented government and institutional support for businesses and organizations. Under opportunities, the pandemic invites and compels us to rethink outdated business models and to innovate. Also to embrace the sustainability agenda and transition to less consumptive forms of tourism and hospitality. In terms of weaknesses, the segments that are the most affected by COVID-19 are also the highest spenders. That's international, long haul, and business travel and events. There's been major disruption to the airline industry, with many airlines in trouble and in need of bailing out. Previous downturns don't give us a reference point for this one. This is quite unlike anything we've seen. Travel itself is perceived to be a risk, both to the traveller and the general public, and there will be low levels of demand when tourism and hospitality restarts due to social distancing measures. Threats include the economic environment and a litany of problems such as a world recession, rising unemployment, the closure of businesses and small and medium-sized enterprises in particular, and a squeeze on spending as uncertainty weighs heavy on consumers and businesses. Also, we're not certain how long this pandemic will last for, and whether there'll be a second or third wave of infections. We don't even know if we're going to discover a vaccine. Finally, we've talked a lot about the new normal, but don't yet know what this actually looks like. The UN World Tourism Organization has published global guidelines to restart tourism, covering all parts of the tourist journey from booking to arrival and beyond, with tailored guidance for airlines, hotels, food and beverage outlets, tour operators, attractions, and destination organizations. The important thing as we ease restrictions is to keep the reproduction or R number below 1. At the time this was recorded in October 2020, R was estimated to be between 1.1 and 1.4 in the UK, which means that the number of cases is rising exponentially. When R is below 1, the outbreak slows, giving the government license to encourage people back to work, reopen schools, and ease restrictions on hospitality and events, among other things. Policies and procedures have been published by some of the biggest names in tourism and hospitality, such as Hilton and Merlin Entertainments, to reassure customers and convince government that it is safe to resume operations. Recommendations include online booking, contactless payments, temperature checks, new signage and deep cleaning, although some of these have been dismissed as mere hygiene theatre, where being seen to act is more important than if those actions actually work. The impact on the traveller or guest experience cannot be understated. For example, air passengers are likely to be hit by a reduction in capacity, although the mooted removal of the middle seat on some flights appears not to have materialised, and also inflated costs and ticket prices, extended wait times, and the closure of airport shops and cafes. Some sectors will reopen sooner than others, and that's largely a question of scale and public confidence and trust in the businesses and organisations that comprise them, as illustrated here. I mentioned that Hilton Hotels had published their guidelines for coming out of lockdown, and pictured here are the 10 high-touch areas in guest rooms that will be subject to a deep clean. I also mentioned new signage reminding people to keep 2 meters apart, or should that be 1 meter plus, as in these examples at Center Parcs Longleat and on the Isle of Wight ferry. In my experience, a significant minority of people ignore the signs and queuing tape, but at least these operations can say they complied with the law and latest guidance and did what they could to encourage social distancing. In the longer term, good hygiene habits and other behaviours will be designed into hospitality premises and facilities. In the post-pandemic hotel, there will be app-activated door locks, so no need for handles, a hatch for deliveries, negating the need for human contact, and paternoster lifts so you don't have to press any buttons. At the Copper Club near Tower Bridge, London, customers can dine in bubbles, quite literally. In this case, the appeal lies with all-weather dining and the view over the River Thames, plus the exclusivity. But expect to see variations of this elsewhere as the food and beverage sector responds to COVID-19 with innovative products. Believe it or not, there are some upsides to the pandemic for tourism and hospitality. The lifting of restrictions has seen more staycations and daycations, and that's good for countries that operate a deficit on their travel accounts. Destinations such as Barcelona that have suffered from over-tourism are enjoying some respite, although the problem appears to have shifted elsewhere and still requires careful management going forwards. Air and water pollution are at record low levels. In Venice, for example, the water is clear and wildlife is returning to the canals. In large cities, streets have been closed permanently to vehicles, creating more space for walking and improving air quality. For example, Google Vacation Street in the Netherlands. There is likely to be a modal shift from domestic air travel to high-speed rail, with some signs of that happening in France at the moment. And carbon emissions have been reduced, albeit with little impact on climate change. Above all, the pandemic presents a chance to pause and reflect on business as usual, and to think about how we want tourism, hospitality, and life in general to develop in the future. Do we genuinely want to do things differently and more sustainably? If so, how can we achieve this, and what will we have to give up? I leave you with these 4 scenarios for the future of tourism after COVID-19, produced by the futurologist Ian Yeoman and colleagues at the European Tourism Futures Institute. The first 2 scenarios are more optimistic and represent a recovery and resumption of business as usual, top left, or transformation in tourism towards a more positive end state, bottom left. The second 2 scenarios are more pessimistic, one representing an exit from tourism as we know it, except for the rich who still get to travel, that's the top right, and the other the continuation of life alongside the virus, which hasn't been eradicated and has brought about a transformation to local tourism and self-sufficiency, that's the bottom right. COVID-19 is a breaking news story, so it will take some time for the academic literature to catch up. Nevertheless, several journal articles have already been published in journals such as Tourism Geographies. There are also useful think pieces in the conversation, like the example cited here, and plenty of information online from credible sources such as the UN World Tourism Organization. Finally, a bit about me. I'm a Senior Fellow of the Higher Education Academy and a lecturer and researcher based at Bournemouth University, specialising in coastal tourism resorts, new leisure and tourism spaces such as urban beaches and virtual worlds, and facility and service design in hospitality and tourism. If you've enjoyed the presentation, please leave a like or comment, or follow me on Twitter at TJGale, where you will find my contact details in a pinned tweet. Thank you.